Hello, America. My name's Paul. I'm 49 years old, father of 2 daughters, and husband of a beautiful, loving wife. I'm posting this video onto YouTube, and it's going to flash over to Facebook, my Facebook page, because I'm a fat man in America. I don't have health care. I don't have a doctor. I'm on no prescription drugs. And I want to make a statement by making a claim right now to the world that I have a mission. I've laid out a plan, and I'm going to work the plan to lose 300 pounds in 18 months. I presently am 523 pounds. I just went down to the scrap yard and weighed in on the truck scale. I have a printed statement or a printout from the scrap yard. And the reason why I'm on YouTube and Facebook is so that hopefully I can get my opinion and my words and my thoughts out to some like-minded people and have some discussions about where we're headed with this country. My first issue that I want to talk about today is healthcare reform. Healthcare reform in the United States of America is an issue that should be addressed. And here's my opinion on what I think that we should be looking at rather than this 1,300-page deceptive takeover of the healthcare system in the country. 4 steps to saving money for healthcare in the United States of America. Step 1, interstate commerce. Interstate commerce of health insurance in this country is being inhibited by the government. That is one of the biggest reasons why you cannot buy affordable health care. Okay? Affordable health care comes from competition. Competition is what drives the price down. It's just like anything else in the free market. And I know you've heard it over and over again, but believe me, when I was 18 years old and at 19 I got my first house, when I had the telephone installed through Ma Bell, I was astonished. The phone was $75. The line was all astronomical prices. Now I can go down for $50 a month, have a cell phone in my pocket, and call anywhere in the United States for $50 a month. That's what competition does to a market. It drives the price down. So interstate commerce with healthcare, for whatever reason that it's being inhibited, it's wrong. It's costing Americans money. It's driving up the cost of health care through insurance premiums, and it should be stopped. Point number 2. Let's see, what was point number 2? Point number 2 was that legal representation. Here we go. Lawsuits. Lawsuits in this country drive medical care up because every day you can sit and watch a TV and you will hear the lawyers with their advertisements. Hey, if you stub your toe, if you think you've been unjustly done wrong and you feel like you have a claim, these people are ambulance chasers. They're trying to get people to come into their office, sit down, talk with them so that they can figure out a way that they can cheat the insurance companies out of money. And a simple resolution to that is point blank, if you lose, you pay. I mean, that's as simple as it gets. There's winners and losers in this country. If you win and the judgment is in your favor, you get paid. If you lose, you pay. That would slow down the frivolous lawsuits in this country actually would bring them to a screeching halt. Because the reality of the situation is those lawyers aren't going to represent those frivolous lawsuits if they feel like they're going to have to come out of pocket. And believe me, they're not going to come out of pocket. The only way a lawyer will take you to court is if he thinks he's going to win some money and he can get you to say what he needs you to say in court so that he can get the money. And when those judgments are cast and those settlements are made, that lawyer is going to walk home with 45% of the take. So frivolous lawsuits are a big issue for me. I don't believe in them. No, I've never been sued by anybody, but I was in the durable medical business for almost 5 years. And with my insurance premiums running about $45,000 a year, I couldn't keep my doors open. I couldn't afford to pay $50,000 a year for insurance, liability insurance, and run a shop of 5 men. It just wouldn't happen. I worked for the Veterans Administration, Medicare, Medicaid, MedWaiver. I had all of that. I couldn't keep my doors open. So, moving on to step number 3. Step number 3 is, I believe, probably one of the biggest money wastes this country's spending, and that is the benefit packages for elected politicians. These health care packages that these elected politicians are being provided, and the appointees and high-level bureaucrats, they are astronomically out of control. This is my opinion. If you're an elected politician, if you are an appointee of the government, if you are a high-level bureaucrat that works in the government, you get a runny nose, a sniffle, a broken arm, a dislocated disc, heart disease, heart attack, cancer, you go to the Veterans Administration. If the Veterans Administration is good enough for the soldiers, the men and women that stand up and take the bullets for us, then it's good enough for elected politicians. It's ridiculous to think that the elected politicians are more deserving for better health care than any veteran in this country. Point number 4. Point number 4 is this. Any government-run entity in this country is a losing prospect. Government cannot run an organization efficiently. It's never been done in the history of government. They just don't do it. There's only one branch of the government that is run in an efficient manner, and that is the United States military. And believe me, there's no one on this planet that can say that our military is not number one. So if your government is telling you that they're going to do better at something that the private sector can do, they're lying right through their teeth. And if you believe that, you're in denial. President Obama, God bless him, he campaigned, and I got to be honest with you, I think this guy has been duped by people in his circles. They figured they could get Barack Obama elected into office, which they did. But once they got him elected into office, they wanted to control him. And that's what's happening. You cannot have citizens of the United States believing that the government is going to pay their gas bill in their cars or pay off their mortgages. This is crazy.